I'm going to talk through a method of securing a drain. Oddly enough, drains can be a controversial topic. There are some who advocate never using a drain. I'm not of that opinion personally. Drains are not always needed clearly, but they certainly do have their uses. An example of this, if I've operated on a patient which has involved significant contamination, I will do a thorough washout. And washout, in my opinion, is one of the key parts of such an operation which has involved contamination. But if you're going to do a washout, then you should do it properly using litres and litres of fluid. Interestingly, in my opinion, the washout also serves the purpose of hydrating the bowel, which can dry out during a prolonged laparotomy. If you've used litres and litres of fluid as a washout, most of it is removed by suction. However, some residual fluid will remain, and leaving a drain in place can provide a route of escape for that fluid. There are other specific reasons for leaving a drain, which can be speciality dependent, which I won't go into. Whatever the indication, if a drain's left, it must be secured effectively. Otherwise, there's no point in placing it in the first place. This is my way of doing it. Again, there's different equally effective techniques available. Ignore the old "my way is the best way" claim that you hear from various people. There are multiple ways of doing it. Find a way that works for you, is effective for you, and stick with that way. In terms of suture selection, I will usually use a silk suture, which is soft, non-absorbable and strong. Silk sutures come on hand needles, which are bigger needles, or smaller needles, which you can use a needle driver. So in this case, we're using a smaller needle, and therefore a needle driver is used to put the stitch and secure the tie. To start with, I'm just taking a bite of skin with the needle and then tying that in place. This tie is going to have to be cut out when the drain is removed, so I don't snug it down to the skin. I normally leave a gap so that it's loose, which makes it easier to remove. Once you've secured it to the skin, then I'll wrap the suture material around the drain in both directions. So you do a full 360 degrees, and then your first tie is forming on the same side that you've got your stitch secured to the skin. Flat knots, and you want to secure these to the drain with enough pressure to indent the drain, but obviously not occlude the drain. Once you've done your first tie, then you're going to again go round the drain in both directions and meet back on the same side, and then you're going to do the same again. This is a silk suture, so at least 3 throws, 4 for look, and then repeat the process, going all the way around the drain again. And you can do this as many times as you want, gradually working your way up the drain, a bit like a Roman sandal technique. Once you've secured the drain, you can either cut the suture at that point, or what I'll often do is apply another stitch to the skin. So I've secured the drain with multiple throws, and then I just again catch a bit of skin with the needle again. So it's secured in 2 places, and this is just a extra precautionary technique so that you're not reliant on just one skin bite. And you can cut the stitch, and you've now got a secure drain. Secured the skin in 2 places with multiple ties attaching to the drain itself, indenting but not occluding.